Hi everyone, today we will be talking about some joint mechanics to help with injury prevention and movement efficiency. The deadlift or hip hinge is a foundational pulling pattern that requires posterior chain strength and mobility. Our posterior chain is composed of our calves, our hamstrings, our glutes, and our erector spinae, which are the longitudinal muscles that run alongside our spine. When performed with a load, this movement also requires supporting stability from our core, our low back, our shoulders, and upper back. We perform hip hinge patterns throughout our daily activities. Bending over to pick up something from the floor, or leaning over the sink to brush our teeth. To avoid injuries in this pattern and encourage healthy mechanics for our hips and low back, we should consider attention to detail in the following areas. Hip and hamstring mobility. Often when we lack range of motion in our hamstrings, we will compensate for it by increasing the bending pattern in our low back. This can lead to a number of injuries, so rather consider driving your hips back and having a slight bend in your knees, and only lowering within your mobility limits. The more we move in a specific pattern, the more our body will adapt, so we want to encourage healthy hinging habits. Spine, pelvis, and core control. Your spine should move as one solid connected unit throughout this entire pattern with or without load. This starts with a neutral pelvis position. By having a neutral pelvis position, this allows the curves of our spine to efficiently manage the load. A neutral pelvis, engaged in your core and braced at every level of your spine, will significantly improve your mechanics, decrease your risk of pain and injury. Thoracic spine, shoulders, and lats. Because this is a pulling exercise, whether you are picking up something from the floor or using weights in a training environment, we must not forget the importance of our upper back and shoulders. When we have healthy extension mobility in our thoracic spine, this allows for an upright, forward-facing chest posture, good retraction in our shoulder blades, and good recruitment of our latissimus dorsi, or our lats. These factors keep our weight evenly distributed, centers our movement over the object, and helps create stability in our thorax. The things to remember with the hip hinge pattern are: keep the weight close to your center, maintain a flat back posture, keep your core braced throughout the movement, and most importantly, drive this movement pattern with your hips. This will keep you moving healthy and efficiently throughout your day. I hope these general tips give you a starting point for your everyday movement routine. If you have any injury-specific questions, don't hesitate to reach out to me here at the Movement Clinic.